Where'd it go?
It's right behind you. Press the button until it turns.
It stays green.
Yep, should stay green.
Oh, I don't know. It's turning red if I hold it. So I'm just gonna. Technology, so fun.
Tough.
Oh.
We have to have that other one, Steve. This one's.
I can also.
1, 2, 3, 1, 2. I think we're good. All
right. Okay. Thank you all. Technology is so fun. And guess what? I'm going to talk a little bit about it too. So it's not going to end today. Hi, everyone. My name is Savannah Sublette-Federico. I am the Executive Director of Kynect Resources. And know some of you all in this room, some of you on Zoom. But if this is your first time hearing about this branch of Kynect, I think it already kind of relates to some things we were talking about, that local community support, community-driven action and resources, and then also data and interoperability. And what can we learn from the data that we're gathering in all these different technology systems across the state? And so I always like to start my presentations by making sure we're all talking the shared same language. So Kynect has 3 branches. And so today I'm only going to be talking about Kynect Resources. A lot of people, when they hear Kynect, historically, Kynect was just, it's Medicaid, right? It's actually more than that, but health coverage and benefits were historically the 2 branches. So this is how you can get qualified health plans, KTAP, all the different 4-letter acronym programs. But there was something when they brought Kynect back around 2019, 2020, there was something more that Kynect needed to really complete this family of programs. If you can go get your Medicaid application in or your TANF for temporary financial assistance application, that's great. But if you need something right then and there, if you need food now, where can you go? If you have a kid that's going to college and you never went to college and you kind of want to know, how can I help support this person, their needs? It could be anything. And these Kynect can't cover it all, right? And so that's why Kynect Resources kind of came as an idea. How can we direct people to the local supports for all the things the state you can't apply for so much. So what can we do to direct folks to their local support agencies and organizations? And so Kynect Resources was made. We don't take applications at all. And this is a free to use directory and referral system for all Kentuckians, all residents and all businesses that are supporting Kentuckians. And as you'll see today, this is a universal system, from schools to jails to nonprofits to hospitals to health departments. If you name a group that is supporting the residents of Kentucky, there's a place for you in the Kynect Resources family, and there's a use case for you. So I'll move along to our mission statement. So our mission was developed with, our mission is to bring together community partners and our Commonwealth agencies into a single platform that connects Kentuckians to their service. I'm sure we've all had the experience of getting handed a directory or, all of our information's on our website, or actually our county has put together this little directory with a grant we got, and well, now we can't keep it up because that grant ended. So there's a lot of different things like that going on out there where there's information, but it's all dispersed. If you're new to Kentucky or just new to even moving across Kentucky to a new county, hard to figure out what's maybe in your area and what all is in your area all in one place. And so that's what we're here to do. Not only are we trying to consolidate all the different cabinet for health and family services and all the cabinet level and state agency programming, getting all those in one website and where those resources can be found. But now we're talking every church, school, anyone that is providing a service, that is a big directory. But we've taken it on because so many people have attempted to in the past, and it's hard to maintain. And so we're taking that on through the partnership we have with United Way of Kentucky. And so the way that we have this mission statement, kind of how we've developed it, and what I'll be talking about today, Early in the presentation, we'll just focus on the public directory. That information is available for anyone and everyone to explore. But the really engaging and data-filled side is the referral management system and what we're learning about where there are gaps in services. What are residents finding is the most successful that helps their journey and helps them reach more stability? So a lot of what I'll be talking today is actually on the referral management side because there's a lot of data that can be shared on that side. But I'll start. If you've not visited our website, this is what it looks like. We've tried to make it fairly easy to navigate for residents. And as you can see, we have some of these tiles. Whoa. I don't know. Can y'all even hear over this? Okay. So on the home page, you have these tiles of populations. And so these we've put together, they are like reentry. So all the services that make sense for someone who is a reentry. There was veterans mentioned earlier. We actually have a veterans tile. So all the programs and services for veterans and their families. The one right below the video there is our pregnancy. And then we also have a separate one for birth to 5 because we know that those programs and those needs can really change in between those two steps. So a lot of different ways that if you feel like you fit into one of these categories, you can hop into there and start exploring a real curated list. But we also have other ways to explore. I'll show here. So we have the organization title. So if you already know where you want to, someone that you have in mind or a program, you can look it up there, and a keyword search like for food, financial assistance, things like that. And then every category has a subcategory to, again, any way you find is best to search to get tailored to whatever kind of resource or program you're specifically looking for. And I just included an example here. So this is a Bourbon County School Head Start program. The website will just ask you your zip code. That'll be the only thing. If you're not logged in, it'll just try to give you the most direct local services. And as you can see from the listing as well, we give you the hours and some of that basic directory information to give you kind of a little taste. But all of our listings actually have a lot more information because we recognize there are barriers residents were facing that we wanted to get addressed. And so if you are exploring the website and you click that Head Start, whatever the title of the program is, you'll move forward into another page. And here is where you can see qualifications. Is there fees involved? What's the next step for a family to get involved in this program? Because that's what we hear is, I might hear about a program, but then I don't really, I show up and I don't have the right mail or documentation, or, well, the registration cycle's already ended. There's a lot of more barriers than just getting the information and knowing that it exists, that residents really need to engage effectively with resources. And so I won't stay too long on here because, like I said, I really think the highlight of our program is the referral management tool. But on this page as well, we have a frequently paired together algorithm. I'm sure all of us are familiar with Amazon. So when you're exploring, you can see, oh, other people have bought this stuff with this thing I'm looking at. Our website works the same. If someone's looking at this Head Start program, frequently paired together might suggest a library kids program and things like that. Related services help the resident if maybe they do not qualify for the one they're looking at, like this one. The related services could show them other options that are similar services that maybe they could qualify for. And then finally, we also show all the other programs and resources offered at this particular location. So in this case, the public school system. So when we think about who's using Kynect Resources, I've named different kind of agency types. This is a good scope, pretty broad. Residents are at the top. Even during 2020, when not the best year to launch a brand new program, couldn't really advertise or do an event, residents found the system faster than anyone. We've had over 800,000 residents use Kynect Resources and make referrals for themselves and just share the information with them and their families, do social determinants of health assessments so that our system can tell them, hey, based on how you answered, you might have a need for food resources or healthcare coverage. And then our system can automatically suggest these resources and help residents kind of have this tool to know what is the best resources and programs that fit me. To speak on all the other engaged agencies here, they all have abilities to make referrals, conduct those assessments with residents, close referrals that their agencies receive. They can search for residents, and there's a ton of data reporting. We're in the Office of Data Analytics. I probably should have started with that. So it's really important to us that people can use data to tell the story. If the data that's collected in the system is live, so as the partners and residents, everyone's using this referral system, the community partners can look back and see, I know that this many people engaged with this program. I know our statistics on how successful each program is on data provision and things like that. So it gets really neat. Our DCBS offices specifically have a role in this for prevention. So we have DCBS offices using the system if they come across a family that's not quite, they can't really make a full case, but there definitely is some, maybe not full neglect, but if the whole family's hungry, they need food, and we don't want it to get to that neglect place, right? So DCBS is using Kynect Resources to find programs and services and connect these families so that we don't have that happen. There's that prevention. Connectors are what are called our eligibility officers, those who are going around and setting up to help people with their Medicaid applications and other things during open enrollment and just generally throughout the year. They use Kynect Resources while they're working with those folks. So if they're like, oh, you want to put a Medicaid application in, what are the other needs you may have? Let me, pass the baton. That's a lot of what Kynect Resources mission is can we make sure that the resident goes to all the experts in the room that can get them the resources that they need? Your school system can't do everything for you, but they can do a lot, for family and school-based kids resources. The library can't do it all, but we know the libraries do a ton of resources and programming. And so this is what we're trying to do, is form a complete picture of how residents are moving in between all the parties. And hopefully at the end of that, we can see that their overall health and lives are improving because they were able to get connected to resources. United Way, like I mentioned, is our partner. So the United Way 211 system, we directly support that through our contract. So before we had Kynect Resources, if you wanted to get, help and seek services, if your county was covered, you could call 211, but that service was not available everywhere. And so through our partnership, now Kentucky, you can call 211 in any county and be directed to a resource assistant who can ask you questions and ask what you're kind of needing and direct you to the right place. Likewise, now with their directory feeding into our system, if you call 211, or if you're more comfortable just using your mobile phone, it'll be the same accurate information that is accredited by the United Way system. And we will talk later about maybe some of our specialists and the fact that we have a true closed loop system. So this is not a referral system where I'm going to send this out and I don't know what happens with that. No, if you send a referral is made in our system, you will get an update from the agency when that is complete, because there are processes in which it's closed and data is given back to you. And they help support that as well. So if the agencies aren't picking up the referrals, if we see a dip in that activity, these folks are ready to engage, contact those residents. So a resident knows that if you use Kynect Resources, someone at the end of the day, someone is going to contact you. A human's going to contact you back, which I think is so important. The last three are some that we have been focusing on in 2025 and in 2026 now. Medical providers are definitely getting on board. We have a lot of great projects like Food is Health, kind of, again, looking at preventative resources so that we can reduce further on health-related costs and readmits into hospitals. State agencies, of course, we're from CHFS, so a good goal for us is starting to get all the CHFS programming in Kynect Resources, but then also engage and collaborate across our cabinet on how we can help the particular populations and residents that they serve. And then finally, our MCOs are getting on board as well, but they're not as heavy users. So I'm going to go ahead and kind of move on to our example. So let's say I have an EMS worker that's on scene, speaks with someone who suffered an injury, but they're also sharing like, well, I'm also struggling with addiction. Then while the caller is headed to the hospital, the EMS worker can make a referral and Kynect Resources. Here are just some options that we pulled from the system. And so that is just a brief example. I know that doesn't show directly from in the system. Happy to, if you're interested, to do a much more in-depth demo for anyone here. But some of the advantages of our system is that it's free. I always like to start with that one because one thing about technological systems, as we've mentioned, they can be extremely expensive. And the interesting thing I've learned in this role is that there's directory systems and then sometimes there's referral systems. But we're both. We kind of do both. But imagine a small nonprofit paying for two different separate systems. And that's what we see. And that's why a lot of our smaller nonprofits and smaller organizations don't or can't even meet the same capacity, meet the same level of, structured service, I suppose, is like a nonprofit that's, running millions of dollars of budget, right? That's the beautiful thing about Kynect Resources is that Norton Healthcare, UK Healthcare, New Vista, all the big names that we know are big sources of care amongst the state can use the same technology system as a nonprofit in Hazard that started yesterday. And the reason that's so important is because if someone from Hazard is at a UK hospital and admits to the social worker there that they have needs, that UK social worker is maybe living in Lexington. She doesn't know what's going on in Hazard. They can use Kynect Resources and get to know the local resources, type in that person's exact zip code and see this is how far away some of these things are for you. I'm going to go ahead and set up referrals so that when you leave this hospital and go back to Hazard, you already got a group of people that are waiting to have your contact information and they can contact you to kind of pass that baton to get you that next level of support once you leave the hospital. Another great thing that we do, because we do serve so many different organizations, sectors, sizes, and types, is we have a lot of customization options. So if you just want to take referrals, if you just want to create them, you can kind of, as an agency, decide how best to use the system to meet your needs and meet your goals. And additionally, because you can just say, you know what? I just want to use the directory. I just want to put my information up and I can't engage. I'm too small. I don't want to deal with referrals. Again, it's just another free platform. We don't even, just to advertise your services, we're not going to charge you. Another great thing I think about the system that it's being proved by the data every single day is that we have faster connections to resources. This takes away the, burden on the resident. Maybe, okay, I'll find my 15-minute break. I'll wait in a phone queue and try to get, call ahead and then get this resource. Or, if they just, I'll go after work. Well, then something happens. Well, okay, I have the kids today. I can't go and get the resource today. There's always a lot that, especially our most vulnerable residents don't have a lot of that free time. So what we're seeing, though, is if a community partner is working with a resident and sends a referral to that next community partner for that next source of support, that resident gets contacted in less than 3 days, on average 1 to 2. Versus residents can, if we're waiting on them to act or waiting on them to, get in a, we don't want to wait. We don't want them to wait to a situation where they're desperate or they're in the ER or they're in an ambulance. We want to make them feel confident and empowered that when they are engaging with the system, there are people out there that care and that will follow up with them and give them the service that they need. And with a unified system, this gives, again, access to everyone, Norton and all the small agencies. We have a unified system with the residents as well. So the residents are actively engaged in the network as well in their own care, working with all the other folks. So residents can make their own referrals. Residents can do their own assessments. And all of this adds to our understanding of the longitudinal, the care journey that resident went on. Where did they start? And where, did they have a lot of critical indicators? Were they in a lot of critical need? And after their journey with Kynect Resources and getting connected to all those different sources of support, did they overall improve? That's the kind of data we're seeing. And it's really, really incredible, the stories I could tell you about the lives of the residents. We have a closed loop referral process. That's what I mentioned. A referral does not go out and Kynect Resources without being responded to. Our United Way people follow up, and they're great at what they do. They have assigned counties, so they're experts in their own counties. We collect the social determinants of health metrics. That's that assessment I've been mentioning. It's very easy, minimal questions. They're all optional. And this helps us understand, are we seeing that there's a food gap in this region or in this ADD area? A lot of data can be gathered on, okay, residents are saying they need these things in assessments. We have a lot of critical needs for food. But when we look at the referrals made in that county, no food referrals. That would be, why is that? And it could be maybe that there's no food resources even in the county. So they're having an issue with food, it's more expensive. So maybe they're looking for referrals of income or rent assistance to offset the cost. These are all the kind of, decision making that residents are having to do in Kentucky. And now we're better understanding, are there ways we can funnel support or funding to the areas that have those gaps? And then finally, I haven't really mentioned this one yet, but it is a big advantage for our nonprofits. We actually pay people with an incentive initiative to use Kynect Resources. So if you know someone with a nonprofit, we actually work with them. We thank them for using our system. And through this incentive initiative, they get $100 for just trying us out. Someone getting into the system and seeing if they like it, see if it meets any kind of need the agency might have. And then $10 for every assessment that they make with a resident moving forward, and $10 for every referral. So the reason this is really big is one thing I've noticed as we're getting hospitals onboarded a lot now. Hospitals generally, they don't really intake a lot of referrals. You can't refer yourself to surgery just as a resident, but they are big referral creators. So when we think about a hospital having patients, maybe care team or social work teams, they're in there making referrals, going out to the residents' home counties. And that's so important for our nonprofits because that is a way that hospitals, while they do not get the incentive, the hospitals are supporting local nonprofits in small counties and towns all throughout Kentucky. So it's really incredible. I keep bringing up Norton. Norton was the first hospital to really work with us. It took us about a year of troubleshooting or so, going back and forth how to best make it work in their process at the hospital. A lot of lessons learned. And that's one of the biggest things is we are seeing now Norton referrals are financially really supporting a lot of counties throughout the state. And so if you are interested in Kynect Resources, we make it really easy to join. There's a claim form on the website. If you're not familiar with the Kentucky Online Gateway, that's the portal system that is statewide. And so a lot of CHFS and other portals run through it. So we're just another one. So you need to have an account to get access. And then before you get to see resident data and all that sensitive information, there is like trainings and some things during the first time login. And this is just some examples of inside the system. I encourage you, if you're interested, to set up a more formal demo, a more technical demo than this overview today, where we can show you a test environment of how it really all works together as a system. But you can kind of see here, referral inbox, where you can get referrals in, referral outbox, and this is where you will go in and check on referrals made to see if they are being worked on and what the ultimate outcome was. So if you're working with a resident and you see them again, you can say, oh, let me go check on that referral. The dashboards and reports are big data sections. So if you're interested in data and statistics, those are live feeds. And we know that a lot of our agencies use that when they do their grant writing and things like that, because the data is just right there. We have client search, ability to search for the residents, of course. My favorites, a way to save a favorites list of resources to make navigating the site and making referrals easier every time you use it. And then finally, just some managerial tabs there for organizations. And here's an example from the UAT. It's not very filled out, but this is the live feed of data. And I always like to highlight this one here, most referred by and most referred to, because at the end of the day, Kynect Resources just wants to reflect the local network. The best thing that can happen is locally driven resource and community and networking. This is just a technical way to look at it. And so this is, I can see this animal shelter is sending people to me, and I can see I'm sending folks out to the hospice and the food bank. So already here are our strong partner connections. And this is just a way for us to say like, oh, hey, if you're not bridging and collaborating like in person and you're just seeing this data online, talk to each other. How can y'all maybe, if there's a lot of collaboration, a lot of residents benefit from the both of you, what if there's something there, like a new resource or program that you two could create that's very locally data driven? And here's a slide about the incentive. And so again, that's $100 for onboarding, just to get someone to try. And then monthly, it is $10 for the assessment and $10 for every referral that is closed. And I believe, so this has been going on since June of 2023. We did back pay everyone from the beginning. So I believe our total is hovering around $90,000 given to our nonprofits. And that is a drop in a bucket for the money that we have. Well, we're really, really wanting people to get on board and start building it up. And there is our email. And I thank you all for your time today. I wasn't really sure how much data heavy stuff to bring. I really enjoyed your presentation. So I'll share some of the more deeper analytics stuff that we're doing in the Office of Data Analytics with some of this data. For example, we can look at how many miles on average are residents driving over time to seek services. We can look at several different data models and all of our community partners on a map and say, well, so many partners, like this is how long it takes if you have to live this close to be 5 minutes away. And you have to be within this zone to be around 10 minutes away driving, and even this zone 30. And so we're really able to get close to that level, right? To see how available are some of these services, especially when we think Eastern Kentucky, things are split up by the mountains and the hollers, you got to drive in. It's not, so just because it looks like on a map you're close may not mean that you're really that close to that resource. So we're learning a lot about also the journeys. Why are residents so often leaving their county, even though we know there are related services in their county? So that's often what we'll see is there are certain counties in Kentucky that everyone really just leaves for other resources. And so is there a gap there? Is it not quality programming, or is it not the particular style that these folks need? All these questions are things that we can start answering and things that we're researching. And so I'll leave you with this. If you all today want to ask any questions or curious at all about a particular region, demographic, or if you're like, can Kynect Resources do this? Tell me that. Just ask. I love hearing what the data questions are out there in the world, and we want to showcase what Kynect Resources can do. And I don't think we've really had the platform yet to do that. So, oh yeah, it's a question. Oh.
Well, they can't hear you online.
Thank you for the presentation, Savannah. I just want to make sure I'm on the same page with you in regards to the social determinants of health assessment, the data that's collected from that. So as an as a health department, are we able to go log in and get data and reports for that, or is there a different type of process?
Yeah, that's a great question. So from a partner standpoint, how you would be able to view that is right now on a resident, if you saw their profile, you would just have that displayed of like, here are all of our categories like food, mental health, substance use, all of our social determinants of health. And it would show those green, yellow, or red indicators for stable, vulnerable, and critical. So that's just how it looks like on the resident. Now, I really do think if you have like a specific kind of report style of like, for these counties that we serve, we want a report generated that looks at this and shows like a bar graph maybe of all the categories. Because that's how I kind of visualize it is in food, here's so many stable on different bars. That is definitely a great idea. And that's exactly why I love meetings like this. Team, write that down and we can make that because that's already kind of a report style that we have available to us. And that's the cool thing about Kynect Resources and me. I'm a criminal justice background. I did not come from technology. So I am learning that once you build something in, you can kind of just plug and play. So if it's built for us, we can just make it available to you all. So if you would like to kind of explore that, and for a health department especially, that totally makes sense for that kind of report style.
Okay, thank you.
Of course. Oh.
Thank you so much. Clearly, this is a big step toward reducing those silos, and I love
Yes.
the collaborative thing. Two quick questions. One is, are there any talks about in the future embedding kind of like an instant page feedback option? Because like when I was looking on my mobile version, I know different people may be accessing the site from different devices or browsers, or maybe relying on a friend or family member. If there were something at the bottom of the page that how helpful it is, like with a rating, or if it was something that wasn't quite answered. My experience on the Lexington Fayette County website that they, I think, did this relatively recently, is every page has like an instant feedback option.
Wow.
And I've really loved that, because if I see something like maybe information isn't quite right, maybe it changed.
Yeah.
Maybe I got a dead link, or maybe I was looking for something and thought I would find it there and didn't. But like that kind of data, I love giving input for, because if that's going to
I was about to say,
feeding the hive.
At first, I thought you're talking about more of a, like what you mentioned, someone sees a listing and the phone number is wrong. We are developing something there for that, where they can instantly let us know, and then we can use that data and go back with United Way and say, y'all need to update this. But I've not seen that. I'm going to have to explore their website and see exactly what that looks like visually. That's a neat idea.
Yeah, thank you. I appreciate what you're doing.
Thank you.
Good morning. Thanks for your presentation. I love how passionate you are about data.
Yeah.
It's awesome. You can tell. I'm just curious, how do you get the word out to the different nonprofits and organizations? I think, for example, a lot of counties hold monthly or quarterly meetings with a lot of partners. And I know there are a lot of people that are not on the list currently.
Yeah.
How do we get them that information and help them understand the benefits of being connected here?
Oh, I love that question, because that's been a big one. Like I mentioned, we launched in 2020, so it was incredibly hard for us to get the word out. And so we've really relied on a lot of like, hey, telephone, do you meet me at a place like this? You invite me to the next. That's another one of the big things our United Way specialists do. If they're not responding to referrals and calling residents, they do kind of work as our event people. They go out and get invited. Like I said, most of them have around 10 or less counties that they are the manager of for those referrals. So yeah, they really get to know those particular counties and have a lot of contacts there. So that's how we kind of get involved in some of those community liaison meetings and events. So it's really been piecemealed. And while some degree that's not, it's not big and bombastic and our numbers aren't big, but all of the work that I started out as an assistant. I was the second person ever hired to do anything with the program, like second person hired ever. And what I've learned is with a program like this, it's built on networks, and I can't force through technology a network to be created. The networks are there at the local level and they're already going on. This was just a way to more formalize, hey, can we get this data all together? Everyone doesn't have to use different systems and pay for them. All the stuff, all the money should go directly to your systems and your program. So it's really been a lot of that, like, hey, I'm a local champion. I believe in the mission of Kynect Resources because it's been able to benefit me in these ways. And then they've passed it along. So if you like share. We have tons of documents and flyers and different things that if you'd like, we can share and you can share, pass them along to your networks. We really, really appreciate that because I feel like, you know, that's kind of how it's always been with us is we're a slow build, but it's because there's a lot of trust, feedback, and I mean, a lot of trust in me as the director too. I mean, I think for most of our partners, I would say 90% of everything we've ever done in Kynect Resources, upgrades and enhancements wise, were direct feedback and ideas like we had today. So I've built everything listening to what the people really need and building our technology to meet that. And I kind of see the future of Kynect Resources right now. We're doing a lot of manual. I'll make a referral. We'll do this. We'll look at your data, make a choice, kind of to where you're saying with the AI and everything's kind of moving to predictability. Is there a future in which like we have information in the system? We know this person's Medicaid. We know that they have this children. This is their income. They would be a perfect candidate for hands, WIC, and like we will be able to predict some of these programs so that maybe I'm no expert in hands or WIC. I'm not the health department. But if I end up at a local nonprofit and a system's telling me this person's really likely to be eligible, where's my referral going to be? It's going to be sending them to the health department to the experts. So that's kind of the future state. But we've just had a lot of slow going because I wanted the system to be built naturally because it needed to meet the technology where the people were at too. Yeah.
We have two questions from our virtual members.
Okay.
The first is, how often are the listings updated?
So United Ways goes by Inform USA accreditation standards. And so they update those themselves once or twice a year. They're calling, they're asking, is this information still correct? But at any point, they make it really easy across the regions to send updates. Most of them use a Google form. So if any time the organization needs to send an update, it's fairly simple.
The second question is there a contact about how to fix services under a listing? We've made changes and need to have it updated.
Oh yeah, if you email us, we can get you connected to the correct United Way region. And they, like I said, most of them have set up a Google form at this point. You don't even have to call and talk to anyone. You just put in your edits. They may call you. That's one thing to keep in mind. Their process, if you're going to send in any edits, is send in the Google form, and whoever they have as your point of contact, usually kind of a higher level leadership individual, they'll confirm the information with that person. So that's how I understand the process goes. So, all righty. Well, thank you all.
Thank you.